I'm Ruth Karron. I'm the director of the Bloomberg School Center for Immunization Research and the Johns Hopkins Vaccine Initiative, and I'm a professor in the Department of International Health.
And I'm Christine Grillo with the Johns Hopkins Public Health magazine. Dr. Karron is here to speak with us today about H1N1 swine flu as it compares to the H5N1 avian flu that has fallen out of the limelight a little bit since the spring. So, Dr. Karron, what can you tell us about the two viruses and how they compare?
Well, a couple of things. One is one of the lessons about the swine H1N1 is that we always need to keep our eyes open. And although I think you're correct that certainly the media is not focused on H5N1 influenza, there have still been cases and some deaths this spring in Egypt, and I think we should never let our guard down when it comes to flu. So just to mention that. But in some ways I would say that these viruses really represent opposite poles of the spectrum in terms of infectivity and ability to, at this moment, to cause disease in humans. So the H5N1 family of viruses, when they infect humans, are incredibly lethal. So really the death rate from these viruses is about 50%.
And just to clarify, that means that of the people who get the H5N1 flu, 50% of them die.
About half of them die.
Okay.
But having said that, this virus doesn't have a great ability to infect humans. And part of that, and so, for example, since we have been tracking the latest H5N1 spread in Asia, what we found is that really over the course of about 5 years or so, hundreds of people have been infected. Whereas we know with H1N1 influenza that we have many thousands of people that we know are infected, and probably many, many thousands more that we have just not detected, that have slipped below the radar screen. So, as I mentioned, H5N1 doesn't transmit very readily to people from birds, but when it is transmitted, we see very severe disease. We also don't see with H5N1 much evidence of person-to-person transmission. You're probably aware that there have been reports of isolated cases. There was great concern a few years ago in Indonesia about a cluster of people in a village where it appeared that there was human-to-human transmission. But these cases have been few and far between. Mm-hmm. So in contrast, H1N1, right out of the box, as it were, starting in April, has been transmitted very readily between humans, it appears. If anything, it seems to be transmitted more readily than the seasonal flu viruses that we know of. But in general, it has caused disease that is, at this moment, and except in a couple of particular populations, is no more severe than seasonal influenza and might even be slightly less severe at this moment.
Right. And you mentioned that there might be thousands of people we don't know about with this flu. How is that because it's such a mild
Yes,
flu?
I think it's for a few reasons. One is that we have, as we've become aware of both the fact that this virus is capable of causing mild disease and spreads readily, we have recognized the fact that the spread may outstrip our diagnostic capacities. So, for example, after the early days of this epidemic in the U.S., when it became clear that the virus was becoming widespread, we were not encouraging healthcare professionals to necessarily test every person for H1N1 in an area where H1N1 was known to be prevalent. So New York City would be a perfect example of that. So there were probably many, many cases, and there have been estimates of the ratios of undiagnosed to diagnosed. I think at this point that's probably anyone's guess, but there are probably many cases that go undiagnosed.
Because they're not presenting with that many symptoms or beyond a bad cold.
That's right, because they have disease that can be cared for with routine measures at home.
Right. I wonder if you could talk a little bit about the containability of this swine flu versus the containability of the avian flu.
Right. So I think very early on, and I think very appropriately, Richard Besser, who is at the time the acting director of the CDC, when he was asked about closing the border between the U.S. and Mexico in early May, said, containment is not an option for this virus. We already know that this virus has gone from Mexico to the U.S., and that it spreads very readily. So at this point, we are focused on what's called mitigation, meaning that we just want to try to prevent severe disease in people who are particularly susceptible, and to be aware of spread, and hopefully to develop vaccines that could be used. But we're not trying to do the kind of containment that I think we all envisioned as we were thinking about the potential spread of avian influenza viruses. Right now, I think that when people were thinking, for example, about H5 as a potential pandemic virus, there was thought that if there were clusters of cases, that one might be able to contain spread by use of antiviral drugs. But certainly that's not the case in terms of H1N1 at this time.
And when you say antiviral, that's Tamiflu and products like that?
Yeah, so the two, for H1N1, the two active antiviral drugs are Tamiflu, which is also known as oseltamivir, and Relenza, which is a drug that's given by inhalation. Yes.
Just to play devil's advocate for a minute, if this H1N1 swine flu is so mild, why are we so concerned about it being so transmissible?
Right. So right now it's mild, but I would emphasize that there are populations that do seem to be at risk, or that we really need to follow this carefully. We certainly, pregnant women, there have been a number of reports of deaths or stillbirths. Pregnant women are susceptible. It's why we have a recommendation for vaccination of pregnant women. They're susceptible to seasonal flu, more susceptible than non-pregnant individuals, young, healthy individuals. And certainly there was increased morbidity and mortality in the 50s when the H2N2 virus caused a pandemic. But pregnant women, there are also some early reports out of Manitoba about Inuit populations. We know that in past pandemics, Aboriginal populations have been at greater risk of severe influenza, and I think these reports are early yet, but I think it's something to follow very carefully. So there are populations even now with the virus as it currently is who are at risk.
Okay.
In addition, what we worry about is the potential that this virus could become worse, could become what we call more virulent, could cause worse disease in people. That has happened with some other pandemics. So we've had what's called a first wave of relatively mild disease and a second wave of more severe disease. So it's why it's particularly important to track what happens with this virus in the southern hemisphere now during what is their typical influenza season. And there's a lot of spread of this virus in Australia, there's a lot of spread in Chile, and in other countries in the southern hemisphere.
Where it's winter.
And
the virus has an opportunity to mutate.
Yes.
Okay. Are there, we spoke about vulnerable groups, are there populations that might have some natural immunity to this virus?
Yes, we actually, the CDC in the Morbidity and Mortality Weekly Report a few weeks ago published, it was a limited study, but they looked at antibodies in individuals who were born before 1957, and that's an important year because that's when in 1950, up until 1957, the H1N1 that actually caused the 1918 pandemic continued to circulate up until 1957, and it evolved and it became caused milder disease. And in 1957, the H2N2 virus there was a pandemic and it replaced H1N1. So they looked at antibody responses in various age groups, and one of the things that they did find was that individuals who were aged 60 and over, so presumably had lived through a number of influenza seasons pre-1957, had some immunity to H1N1 swine flu, our novel virus now. So one of our typically most vulnerable groups to severe flu disease during seasonal outbreaks may have some pre-existing immunity.
Okay, so the people over 60 may be a little better off fighting off this flu.
They may be.
They may be. So Dr. Karron, even though H1 has sort of taken over the media right now, are we still tracking the H5 avian flu as vigilantly as we have in the past?
Yes. So I think one of the important things to think about is that we really do have a very robust system in the world for influenza surveillance. We have Sentinel surveillance labs all over the world that report their findings to the World Health Organization. Those Sentinel surveillance sites are picking up, a lot of them are picking up H1N1 influenza right now, but they are equally equipped to detect any influenza viruses. So they would be able to detect H5 viruses or H1 or other viruses like H9 or H7 that might circulate.
Okay, great. Well, I think that wraps it up. Thank you very much.
Thank you, Christine.